Welcome to American Medicine Today. I'm Ethan Euchre.
And I'm Kimberly Brumell. We're here at the University of Central Florida in Orlando with Dr. Narendra Singla, professor of medicine at the Burnett School of Biomedical Science, where they have created a way to produce customized 3D printed hearts that can be used for practicing surgery techniques on children. Thanks for having us, Dr. Singla.
Thank you.
Now explain the need for this, because obviously, specifically in children and infants, the hearts are so small. Why is this technology necessary?
When the new children are born, and many of their congenital heart diseases are also come with them. A newborn child is a tiny heart, and we are going to perform a surgery onto that. Even you think of doing the surgery, it is threatening for the parents as well as for the other audience. But we have to do that. If we don't do that procedure, the child may suffer from a significant damage or may die.
These risky open heart procedures are performed using knowledge gained from CT scans and MRIs, which are just that, two-dimensional pictures of living real-world organs. Using new technologies and tools, Dr. Singla and his team were looking for ways to enhance the resources available to a doctor before performing these procedures.
We take the same CT scan or MRI data, do some computer manipulations, and work on to the things, whatever needs to be done. Then physically, we print the 3D heart, and which has a special distribution of all the layers and where could those defects could be.
This allows surgeons far more specificity in the defective areas and even allows them to open the model and view the anomalies from within.
What you're saying is doctors no longer have to perform surgery blinded. Now, maybe that's kind of an inappropriate term to use.
Right.
Because they're using 2D images,
Right.
but now you've taken it so they have that 3D model that they can look at. They know where the pathologies are and it can get their mindset.
They will be more educated and
Correct.
more specific when we are giving them the 3D model.
Many times patients require more than one operation in order to find and fix complications. This new technique of using a printed 3D heart should lower that need dramatically. This should also reduce the cost of the procedures for the hospital and therefore the patient.
As a mother myself, if my child had a problem with their heart, I would choose to do this so that you know in your heart you're doing everything to give your child the best odds possible. And what a great tool for the doctors.
I agree. Parents are more satisfied. They know what is going on. They know what the time frame is.
The physician, the surgeon, probably has a pretty good idea what it already looks like. They've probably been there before. But to break it down to a parent that this is where the problem is, this is where we're going to go in, this is what we're going to do.
I agree.
Really helps kind of educate the parent
Yes.
as to what to expect and what's going to happen.
And that decreases their stress level and give them a more relief. Stress is also a major factor nowadays to get more diseases, even your child is in the hospital.
And you and I know, as lay people, a lot of these medical terms and when things are described to you,
You don't visualize it.
well, you half the time don't even know what they're talking about because they're 20-syllable words that,
Yes.
We're not familiar
that
with.
we're not familiar with. So, to be able to break it down to the parent like that, I think is very helpful.
In the future, they plan on printing control models, which are sex, age, and even disease specific.
And the next step is to be able to use it patient-specific, case by case.
Right.
And how far off are we from that?
If we are successful, everything goes as we planned. Within a year or two, we at
That's
least
great.
have the model, disease modeling.
Currently, they are in the research and development stage, but their goal is to perfect and simplify the process to be used around the world.
If we can make those available to the world, there might be millions of children with a similar sex, disease, and prognosis will be there so they can be used.
So to get from the CT scans or any of the scans that you're going to use to this 3D printed model, what type of time frame are we talking?
If you're talking a tight time frame, one after the other, if a doctor gives us a CT scan today, within 1 day or 24 hours, we can turn it around and give that model ready, saying, oh, this is what we have.
The multi-stage process is quite intricate now, but as more modifications are developed, these tasks will be further streamlined. Now, where did the genesis of the idea to use 3D printers come from at UCF?
I was teaching the stem cell biology class. Then I throw my idea in the class, and you will see the two students, Jessica and Kelly. They were volunteer to come into my lab, and then we worked it around. We bought the cheapest printer available maybe on this earth, and you don't want to ask the price of that. And then we did our own manipulations.
Once they settled on a printer technique, they began to perfect the model itself.
Here is the model which we, 3 months before we were using the prototype type model, and you can see in this model when we cut the heart, from the inside it looks like it's a flat.
So initially they were completely solid inside.
Right.
There weren't hollow
That is
No
ventricles.
definition.
There's no definition,
Atrium.
completely hollow inside. But with the time, within 2-3 months, we made the different opinions, get into the more details. From that, we reached into this stage. You see now the distribution, the heart is more there. And
Yes, more
still
intricate.
more interpreted and more look like a heart model as we have inside our body.
We speak with students of Dr. Singler, Jessica Helene and Kaylee Garner.
We both approached him after class one day and we were like, oh, wow, this is really interesting stuff. Like, are you doing any of this in your lab? And he was like, I'm interested in getting started in it. Would you guys want to help me? And so, of course, we were just shell-shocked from that. And it's just, gone from there since.
We used very specialized high-end software to develop a 3D model from CT images. From that point, we are basically perfecting the process of printing.
These are just your run-of-the-mill 3D printing plastics, ABS, PLA, very common types. There are more specialized materials that we're looking at using that better mimic the heart tissue, so that way it's even more realistic so that the surgeons can practice it. There are some materials that are flexible so that you might be able to squeeze one part and it would show you the blood flow or whatever the case may be.
The heart is a general form, but not all hearts are the same. There may be slight variations here and there, and that's where the model really comes in handy because you're doing it personalized to the patient. These surgeons can literally take the 3D model, show the parents what they're going to do, also show their medical staff how they're going to go about doing it, really fine-tune that process of pre-surgical to surgical to follow up and hopefully, great recoveries.
And another big next step is the bioscanning, where
Yes.
now, again, this is more of a demonstrative device where you're showing people, but obviously surgery can't be performed on this.
Correct.
Is that the goal moving forward, where they can practice surgeries on these?
Right. This is possible, but we are having some difficulties with the material, the type of material. But I would say before we go for surgery, I would use more accurately for the education to the medical students.
Training.
Sure.
Training, because they do not know, they know only congenital heart disease. They may know vascular septal defect, they know many other hereditary diseases, but they do not know the exact spatial distribution, again I use the same word, where the disease occur. Even in those days, slowly, when we are having such this handy tool, they may not need to have the 3D heart printer. They say this disease matches, and we already have the knowledge of that, and they can go for the procedure.
So if people are watching and they want to become involved and help fund you so that you can get your hands on the best equipment, how would they do so?
They can approach me directly, or they can approach the College of Medicine.
Currently, their available funds have only allowed them to work on the heart. However, this technique can be used for nearly any organ in the body.
I could see this being used for brain models,
Yes.
really any organ.
Any organ. We will be happy to convert this into a diseased model, big 3D center facility if somebody would like to do that.
Well, thank you, Dr. Singla, for showing us your work here at the labs.
This is my great pleasure to share my work with you guys.
Thanks so much. Coming up next, our Back to Life segment.